Hey guys! For our student-directed study, we chose to research this really interesting thing called Opioid-Induced Hyperalgesia. What is this really long name? Well, it is a phenomenon observed in patients treated with an opioid, who paradoxically demonstrate an increased sensitivity to painful stimuli. Some other symptoms of OIH are a spreading of the pain to other parts of the body other than the initial state, and an increase in the pain. There was one key medication in that description, the opioid. And what is an opioid? Well, opioids are drugs that act on the nervous system to relieve pain. It is a substance that acts on opioid receptors to produce morphine-like effects. Medically, they're used for pain relief. A very common opioid you might know of is morphine. You are usually introduced legally to an opioid that is prescribed by your doctor for pain. But people use opioids illegally, such as heroin addicts. There are several theories for the causes of OIH. A main correlation between them is the neuroplastic changes in the central nervous system and the peripheral nervous system. What are neuroplastic changes? Well, basically, the brain changes, and when the brain is susceptible to change, doctors call it plastic. The CNS, or the PNS, are receptors of pain, and the CNS is receptors of pain on the spine and the brain, and the PNS is a system of nerves everywhere besides the brain and spinal cord. A main mechanism known as the central glutamatergic system, central meaning in the central nervous system, and the N-methyl D-aspartate NMDA receptor. The changes in the CNS and PNS causes lead to sensitization of the pronoceptive pathways, which are basically pathways in the brain that sense pain. Glutamate, which is a chemical compound, plays a central role in the development of OIH. Acute and chronic opioid use increases N-methyl D-aspartate receptor activity. Several scientists have found that prolonged morphine administration causes a downregulation of spinal glutamate transporters in the spinal cord, leading to increased glutamate levels available for NMDA receptors. Glutamate-associated activation of NMDA receptors can cause spinal neuron sensitization, which can cause OIH. Now, since OIH is a relatively new clinical phenomenon, the treatment and rehabilitation of people suffering from OIH is hotly discussed. Scientists' ideas to treat opioid-induced hyperalgesia is to some scientists think those with OIH should stop the use of opioid completely. Some think doctors should gradually wean them off the drug, but the process could take a long time. And others think that rotating to a different class of opioids, such as providing a different opioid in a smaller dosage or giving the patient an NMDA antagonist, which will help to block the overly sensitized pain receptors in people with hyperalgesia, such as ketamine. People tend to confuse OIH and opioid tolerance, but OIH is different than opioid tolerance because opioid tolerance is when a drug becomes less effective over time. Some people experience OIH and some do not. Doctors believe it has to do with genetics and the length and amount of the specific opioid, but most is unknown. Since there is no clinical data, only experiments performed, OIH is still being researched, and many experiments are being done relating to morphine and heroin users. Now, to prevent OIH, researchers have found that nitrous oxide reduces post-operative opioid-induced hyperalgesia. Thanks for listening, guys.